Okay, now that Mr. Lehman's back, we can start. Good morning, everyone. I would like to call the Health Services Committee meeting to order. First order of business is to approve last month's committee meeting minutes. Motion made by Supervisor McDevitt, second by Supervisor Conover. Any discussion? All in favor?
Aye.
Opposed? Carried. Okay, we're going to start with public health and Pat Hour.
Okay, first thing we'd like to do is request a resolution to increase our charge for nursing visits, from $170 to $200 visit, effective the 1st of January. We haven't increased our charges in a couple of years, and whether or not we get the full amount, probably not, but at least when we can demonstrate our costs, we stand a better chance when we, go to negotiate our rates.
Okay, to get this on the board, or on the floor, rather. Motion made by Supervisor Taylor, second by Supervisor Devitt. Any discussion?
Well, how does this compare with the marketplace generally?
We're lower.
So we still be significantly lower.
No, Tammy, you could probably speak better.
We're well under the regional rates, even at the $200. And where that comes from is every year we're required by Medicare and Medicaid cost reports. So this is a rate that's promulgated through that. So we go through the cost reporting mechanism, and it determines a cost per visit for all your disciplines, whether it be skilled nursing, COT, or whatever. And this is more in line with where our costs are actually running. So you always want to make sure that your rates are up there, so when they create a Medicaid rate, they don't reduce it basically based on, because they'll use the higher of, or the lower of your charges or your costs. So you want to make sure that your charges are high enough so that you don't take a hit there.
I understand. Thank you.
This will help the bottom line.
Oh.
$30, yeah. Okay, we have a motion and a second. All in favor?
Aye.
Opposed? Carried.
Okay, we would also like to request committee approval to authorize Sharon Chaldone to attend the Home Care Association Quality Symposium in Albany on November 19th. And this is just one of the things that we need to do to keep our quality improvement initiatives and all the resources and everything going, and we have money in the budget for that.
Okay, motion made by Supervisor Conover, second by Supervisor Frazier. All in favor?
Aye.
Opposed? Carried.
We would also like to request a referral to the Personnel Committee to create a part-time, not to exceed 24 hours a week health educator position for the WIC program and amend the table of organization accordingly for the duration of the 100% grant-funded initiative that was funded through the release of the unallocated funds. And we've already gotten permission to amend the budget for the funds, and I thought that we would be able to keep the person that we have in place on a per diem status. But I've been told that because her hours are going to increase just for the duration of the grant, we need to create the part-time position, and then when the grant is done, we need to delete it. So it's just what I've been told to do.
Mm-hmm. I'm assuming this was approved by Paul?
Yes,
okay.
We had a conversation
okay,
about
good.
it. Yeah.
Okay, we need a motion to get this on the floor. Supervisor Conover, second by Supervisor Frazier. Discussion?
Just, is this, how have you reflected this in the 15 budget?
Bill, Taunton.
If I can just because when I saw this, it just hit me, we just got the letter dated October 14th that the grant was approved. So it just hit me, I just emailed Joanne and I just brought it up that we are going to amend, or they're going to work on this and add this to the 2015 budget because the detail of salary and expenses, it's a break even, so it's no impact to the bottom line.
So there's no impact here?
Yep,
okay, I understand. All right, thank you.
Fully funded through WIC, so I just needed to break it out for her, and I got it right here in my hand to give to Joanne as soon as we're done.
Thank you.
What would we do without you, Ton? Keep right on top of that stuff.
Hey, just forget about that, because of course, when they gave us this notification of this TIP grant, I think it was August. It was after pretty much we had already sat down with budget, and we had to wait for them to approve it, and we just got the letter like a week ago. So, like I said, then it just hit me, oh, wait, we gotta add that to the 2015 budget, so.
And we didn't start the employee because even though they told us on the phone and they were not real happy that we wouldn't take their phone call, we said we needed to have it in writing because you never know with these things.
It's basically to increase revenue per the grant and then increase the expense line, and it's a wash.
Right.
Thank you.
Supervisor Taylor?
Just a question for Tom, I guess. This is a temporary position, and when the grant expires and we don't have the position anymore, how is the unemployment, does that covered by state, or is that,
I don't know how that works with part-time. I assume it would, it's more of an, I guess, an HR question, I'm not really sure how that would work.
all right?
And if we do, and the other thing too is to consider, the position she was in before this was one created with WIC, and then this was created now because of this, so it could also, something could happen next year again with a new grant and might need a position again, we don't know, but at this point, it's just for the year that ends, September 30th of 2015.
I would think that by the personnel committee that, you know, maybe that would be a good question to have answered. Like I said, from my perspective, it would have been quicker and easier to just increase the numbers of the per diem hours, and then we wouldn't have got into this, but we can't do it that way.
I would
Currently, I think, or before October 1st, she was supposed to be 20 hours. She's been working 20 hours all year. This is moving her up to 24.
When you get 24 hours, you get prorated, vacation and sick, which really for that short of a period, it's not gonna really amount to much, but, because of the civil service laws, you have to do it.
Regarding fringe, it's only FICA and Social Security and Medicare, that's it. There's no health, dental, or retirement involved in this position.
Okay, very good. Any other discussion? Okay, all in favor?
Aye.
Opposed? Carried.
Todd, you wanna talk about your budget transfers and amendments?
Attachment number 5 is, basically I'm just asking, our VT grant started, a new one started July 1st, and we need some of the expenses, since it goes till next June, I need to, usually about this time of year, I have to bring in some money to kind of meet our expenses. So I'm bringing in for phone expense, postage expense, and gasoline expense about $1,200. Again, it's like the WIC program, it's fully funded, so I'm increasing the expenses by that and increasing the revenue by the $1,200. You wanna see attachment number 6 is, I just have one transfer. I know we're trying to get our new cars and the fleet updated, and, no more cars were anticipated this year, but we had 4 cars go up, of which 3, well, technically all 4 could be considered not workable, but one of them we did repair, so we could keep one in the fleet, so we could have one. I believe Joanne's already asked for, prior for one car to be bought through, the county's, I guess, access program, whatever that is, and asked me to find money if I could for one. So this is just moving the, $17,000 for one car from our early intervention, excess and travel and education is called, over to equipment. And that was, like I said, because 3 cars actually recently died.
Okay. We can do both of these together, if that's okay with the committee. Motion made by Supervisor Conover, seconded Supervisor Frazier, all in favor?
Aye.
Opposed? Carried. Okay.
Okay, we don't have any pending items this month, so moving on to our information for discussion, you'll see attachment number 1, our monthly emergency response and preparedness report. And if nobody has any questions, we can move on to the status of our referrals, and Sharon is unable to be here this morning. But if you look at, the report, you can see that even though we're still down, we're ahead of last month, and so we're really holding our own. It's been really busy the last couple of weeks, so we're doing fine there.
Any questions? Okay.
Okay, reports of expenditures, revenues, overtime, and per diem, and actually we have, and our comparison reports that we affectionately refer to now as the Conover page. Because even, I don't know, I guess if we could also talk about our attachments as the Mr. Loeb attachments, because things that we've done to modify our agenda, I mean, we like the Mr. Conover report. Tom and I were just talking about that, because it does provide us some really good information.
I think because usually this time of year, I mean, we're into the, October, usually you guys will say that our revenues aren't more than half and our expenses might be okay, and I always say, well, just bear with me, when we get to the end, it'll all work out. But yes, attachment number 3 actually, which is the report Pat's talking about, it does compare this time last year to this time this year, and you'll see we're very consistent, very comparable. And again, I usually say we may not meet the revenues that we budgeted, but we don't meet the expenses either. So we try to keep that bottom line impact the same or if less to the county. So you can see on attachment number 2, which is our full financials as of this month, it includes the first payroll for October. Again, we remain down in both regular salaries and overtime, and also our part-time salaries are up due to the fact that we're using per diem staff to help with those, situations. Overall, we're, 22,781 below last year, and we were 20,000 last month, so you can see that it's getting better and hopefully consistent. By the end of the year, you're not gonna see us be more than last year's salaries, which is good. And you'll see that we're 74.87% of salaries to budget this year compared to last year at this time, we were 76.54% of salaries. So, again, that's, on that end of it, it's good. And again, back to attachment number 3, if you wanna do the comparison. The other thing too, besides the fact that our preschool and our early intervention, I know I mention every month, you know, those things usually take a while to catch up, getting those expenses and revenues in. Also regarding most of this, we do try to keep track of our revenues too for our child. We've been trying to close the month earlier. So I can honestly tell you that last year at this time, those revenues did not reflect last year's, and we've already included September in this, I approved them. So even though that's a little bit more, a little over $500,000 difference from last year to this year, I know at least part of that is the revenues because we're closing earlier, which is good.
Nice. Okay.
Mr. Chairman, let me say this is, one of the nicer uses of my name,
Give me some that aren't so nice as you like.
Supervisor Wood?
We have public health here today. I know there's a emergency preparedness group that meets quarterly, and reading the paper today, I noticed we've got Ebola in New York City, and I was just wondering if maybe somebody here could speak a few minutes to what some of our preparedness measures are, or how we're rating. We're kind of a tourist destination up here, and so I wonder if somebody might have any input or comment they could provide.
We only have about 4 hours, so.
I think, that we're a work in progress there, but one of the things that I can say with full confidence is that, public health, we're no strangers to infection control. And so anytime there's the opportunity to beef up that, and I think that's where we're going to be going, we'll certainly do that. Do we have all the answers? No, but I can tell you that we're spending a lot of time on conference calls. I don't think the State Health Department has all the answers. CDC is certainly working on it, so when you've got that many people involved, certainly we weren't too pleased to hear about the situation in New York City, although not really surprised. So, all I can say is we're working on it. The volume of information is huge. Janelle probably there's a commissioner's order that's out that they're trying now to decide how much of the commissioner's order needs to be followed by places like us that, you know, we're really not we don't have primary care clinics where sick people are most likely to show up here, but we have to be prepared. But some of the things that are in the commissioner's order are like if a sick person presents, you're supposed to have a special bathroom for them, a special place to isolate them, and for those of you that have been in our space, there's things that are really not appropriate. So we're working through that, but we also want to be compliant and do everything we need to do legally. So we'll certainly keep you up to date with that as well. Janelle's been working closely if you have.
Right. We did just have an emergency preparedness meeting this week, and those are very good meetings. We get very good response from our partnering agencies. EMS is there, fire's there, our emergency services office is there. We've reached out to the EMS community. Jamie Schrammel with the fire department's been providing training for them with the best knowledge that we have to date. He's instrumental in planning. He's been doing a great job with that. We've been trying to kind of take all of our guidance that we're getting from our different state offices and trying to kind of seam and fit them together so that there's not a disconnect agency to agency. I think in Warren County with all of our partner agencies, we fit and work so well together. There's no turf issues that you see in a lot of other places. The hospital is the one that's directly responsible for the commissioner's order. Even though we all fall under the same order, the hospital it was predominantly written for. Our hospital has been working and planning and drilling. We just had a forum last week where the hospital was there, public health was there, some of our other emergency agencies were there explaining to people how we all coordinate our plans together. I think we might not have all the answers right now, but we have a lot of smart people on the ground level working, And I think the idea is always you're able to pick up the phone and call somebody in the know. And I feel sure with that locally that we have good people and good places. We are waiting for official guidance, official documentation, things in writing. Those are things we can't speed up. Unfortunately, when the CDC comes out with the guidance and information, the state health department then reviews it and then makes it recommendations and guidance of which we're obligated to follow. So there's a little bit of a delay in information when it comes to us. But I really, are we 100% prepared? I don't, I would not want to go out on a limb and say that because I think we can always improve where we are. But since 2001 and even prior to that, we've been writing emergency preparedness plans. We've got continuity of operation plans. We're kind of like working on that right now in our office and trying to accommodate all these Ebola calls and writing new plans and this, that, and whatever while trying to do what we're normally doing as well. But if people have specific questions, happy to try to address those. But I really think we're as prepared as we can kind of be, and we're in a good position right now.
Yeah, the health centers also need to be involved with because they're certainly gonna be frontline places where people, if they just have a little fever, could show up as well.
And a lot of times, our agency serves as a good resource in interpreting and assisting other agencies such as schools. We've had a couple calls from schools. What do we do if we get somebody, and helping the schools come up with plans, helping the doctor's office come up with plans. And like Pat said, whether it's TB or H1N1 or hepatitis A, we know about contact tracing, we know about personal protection, we know, there's so many things that we know but need to be built on specifically for Ebola. And there's still questions out there as far as what kind of PPE you really need for. We're hearing it's blood and body fluid, we're hearing it's not respiratory. Just on a conference call this morning, they're saying, if somebody comes in to a treatment center and you've got people in the waiting room, what about the people in the waiting room? And the thought is, well, unless they've been, exposed to blood and body fluids of those people, they're not really concerned about the exposure. But, we're still in process of verifying that, making sure that we're 100% right with that.
One of the things with...
Oh. Does anybody...
Just, if there's another question on this subject, just maybe a quick update on the flu season shots. I know I had mine the other day.
Very good.
We have the health fair today, so any employees that are looking to do it can have that. We have been doing our clinics around the county, and you can get them at pharmacies or whatever. And people, I think, hopefully the Ebola thing will heighten people's awareness, so they'll get, maybe it'll get more flu shots out there. But there's certainly plenty of it to go around, and
just plenty to go around.
Oh, plenty to go around. Yep.
Supervisor McDermott.
When you watch too much cable news as I do, I was reading the news, or listening to the news this morning, and there was a doctor on CNBC, and he was, and I was kind of surprised at his answer, and which created a little bit of controversy, and the question was, what if I'm touching something in a subway that someone with Ebola has touched, and now I touch it, and the question was, can I now catch Ebola? And his answer was yes. And he never really got much of an opportunity to explain himself, but I'm sitting there kind of like, it doesn't sound right, but I don't know,
With infection control, it would have to be blood or body fluid that would have to be there that somebody would be exposed to. I'm not probably the infectious disease expert, but typically with diseases you have to have some type of open cut or scrape or mucous membrane type exposure to get that germ into your body. With Ebola, I'm not quite sure what the vehicle is because we're still waiting for our guidance for the PPE, and I think they're still trying to answer that question. But
there's probably different degrees. If somebody was vomiting all over the thing, that'd be one thing, but just somebody's little hand, probably not so much. But one of the challenges with any disease is not only do you have to take care of the people that are ill, but you have to worry about the worried well. And they are by themselves a pretty big challenge. And you don't want to diss anybody because anybody that wants to ask the questions, they're truly concerned. So we got to be careful that, that is as much of our mission, I think, as taking care of people that are sick.
And I think also working with different industries and disciplines, such as people that deal with waste, funeral directors, just making sure that whatever role is involved, whether it be accidentally or on purpose, that everybody has the information and the resources they need to be as prepared as they can be. And that's kind of where we're at.
All good
But if
questions
you have
then.
constituents with questions, you know, feel free to have them call us. We do get some calls at the office, and we're happy to give them the information that we know, or refer them to the guidance that we're...
Or if you're with your constituents, if you feel that anybody's panicking or whatever, please send them our way, and we'll have a nice calm talk with them, and if they have legitimate questions, we'll point them in the right direction.
Very good. Anything else for public health?
No, we do need to schedule a special meeting, though Paul was gonna be here for next week, but I guess we can do that later.
Yeah, we'll get notice out for that.
Okay, sounds good. Other than that, we're good.
Okay, sit tight, we have, Westmount coming yet. Thank you, girls.
Thank you, very good.
Good job, have a good weekend.
What time are your shots today?
Oh, until, what is it, 2 o'clock over there at the health, you should
You-
go over to the health fair, I
Okay.
think they'll give out free frisbees or something.
Okay. So you go through lunchtime?
What?
You go through lunch?
Oh,
Good,
sure, a lot of
good.
people go in there once.
Okay.
It's a hard thing is
Peter.
the,
And another thing I think with that answer, like, we as Americans want an answer right away, and right now there is no
you're
answer,
right.
so he's probably just giving you the...
No, and we live in instant news. We want-
Exactly.
It's just crazy.
Exactly.
Is that cake still running?
Oh, I don't know. No, it's not. Are you guys all set? All right. Okay, we will continue with health services. We have Westmount. Lloyd?
Thanks, Mr. Chairman. You have your agendas in front of you. First item on the list is a resolution request. When we requested maybe last month, regarding repairs to the water system over at the home, we had the main 4-inch line was basically corroded and was weeping quite a bit, so we had to have that upgraded. At the same time, almost, we found out that we had the backflow preventer on our sprinkler system needed repairs also. It's 3 years old, but we think there's like maybe particles and some of that type of stuff in it. They're a type of item that's basically better to replace it than try to rebuild it, and I think the cost is about the same. So this dollar amount of $25.54 should have been included basically in our first request, because to do both of these items, we had to shut the building down of water. And we accomplished this 2 nights ago. Everything went very well, and support from the county as far as backup water systems. We had no effects on resident care. Maintenance guys were there all night. The repairs to the building took about 8 hours, and everything was up and running by about 2 in the morning. So this project was accomplished at that time, and the repair to the roughly 40 feet of 4-inch line was replaced at that time. Roselle Plumbing did the job, and they did an excellent job. Everything's working, the ceilings are all back in, and we're all set. So what we're looking for is to put this in as an add-on to basically that other resolution that we had about a month ago.
So they already did it?
Yes,
So we don't have to pay them then?
we don't have to.
Motion made by Supervisor Taylor, second by Supervisor Conover. All in favor?
Aye.
Opposed? Carried. Thank you.
Thank you. I'm gonna do number 3 next. This is a request to basically create a new position, but we're gonna get rid of 2 other ones. In our activities department, we have 2 24-hour positions totaling 48 hours. We'd like to change that to basically 1 full-time position, 40 hours, and 8 hours of a per diem position, keeping the same exact number of hours. We're not adding or deleting any hours of service. But we have we've went through human resources, all the people involved regarding permission to do this, and they've given the green light to everything. Paul Dusick's aware of it. He had no issues with it. So basically, we're taking 2 part-time positions, making 1 full-time with a per diem, just some flexibility for some weekend activities and that type of stuff.
Okay, get a motion, please. Made by Supervisor Frazier, second by Supervisor McDevitt. Any discussion on this?
Just, if you could please, the two part-time positions, or I should say, or the two part-time positions, are what type of positions?
Activity aid, basically doing activities with the residents of the facility. Anytime, like from one-on-one to cooking group to bingo, you name it.
Both positions?
Yep.
And the
And-
full-time position is a?
Basically it'd be an activity aid also, but it'll be one person doing all the hours. And the two positions right now, one of them is vacant, so we're not getting rid of any staff or anything. There's nobody being let go or anything, so we have the opportunity now to make this change without, moving any actual people around. Cause the one part-time position is empty and one has a person in it who'll take over the full-time job.
It's budget neutral?
Basically, yes. Yep.
Any more discussion? We have a motion and a second. All in favor?
Aye.
Opposed? Carried. Okay.
Betsy?
Item number 2, resolution request transfer of funds, and I forgot to put numbers on the bottom of your pages, I'm sorry. We're requesting to transfer, the money into nursing overtime, about $10,000, and, we have a little extra in the full-time, regular salary position. We're also running low in some of our equipment funds for, bands, wander guards, that the residents use, so I'd like to move money for both of those general ledgers.
Okay. Motion made by Supervisor Taylor, seconded by Supervisor Conover. Any discussion? All in favor? Opposed? Carried. Thank you.
Do the overtime report?
Okay.
Yeah, we'll do that one next. Do the overtime.
Okay, the last page, the 2-year budget comparison, we seem to be on schedule. We're, are a little bit lower in your regular, a little bit higher in your part-time. That is because of the new positions that were created. Overall, we're a little lower compared to last year, which is good, and if we annualize it out, it'll be very close to what we've budgeted. I'll have to do some creative transfers next month to kind of clean up. We're over and under here and there like I do every year, but pretty much we should stay within our budget.
Excellent. Okay.
I'd like to discuss staffing report a little bit of where we stand and how the staff is doing over there. We still have within the nursing department several vacant positions. That's kind of ongoing. We put an ad in last week. We did have a fairly good response, so we're doing some interviewing this week. As we've talked before, whatever we don't have in staffing usually is made up through agency. I mean, that's kind of the nature of the game, or time and a half, or whatever our in-house staff can do. We're holding our own, and I think this is gonna be ongoing. Dietary, housekeeping, all those departments are solid. I don't think we have any openings. And your department head level people within the facility are solid, so we haven't really lost any of our key RN people or on that level. So, we're doing, I think, a pretty good job as far as retaining the staff we have. We have a couple people out on disability. We have no comp cases at this time. There's no active pending or anything, so no workers' comp cases right now. We have about 6 people out on disability for various reasons. 3 were maternity, 1 was carpal tunnel, this type of thing. All of them are expected back November, maybe first week of December. So having those people come back obviously helps our staffing. So I think we're in fairly good shape, and as I said, we're holding our own over there with all the issues that are going around surrounding us. Couple other items for discussion. As we just alluded to, we had the 40-foot section of main pipe that comes into the facility was rather corroded, and almost to the point where you could poke a hole in it. So I think we made the repairs just in time, and the backflow item was completed, and they were done this week, and that's all set. We are having an emergency drill on October 30th, so if any of you are listening to scanners or anything, it is a drill with the Queensbury Fire Department. We do it every year about this time, and they'll come and we'll do it on North End. Actual, smoke machines, that type of stuff. They're training their people, we're training our people at the same time. so any new firemen will be exposed to our facility and the physical layout and that type of thing. And I guess it's been going for many years with, the fire departments and, the county home, and it's worked out very well. We're required to have 2 major drills per year in addition to fire drills monthly. So this will help us out on, get us the one for the major evacuation, and we use the fire or the water repair as our other major drill of a water outage, basically. So we've got those 2 in for the year. We're still in the, window for survey. They could come anytime from like a month ago to March, so from 9 months to 15. So we're still in the window. They could come anytime, and we're expecting them. Facility census today is 76 out of 80, so we made a couple of bumps up. We were running 72, 73. We're up about 76 today. It's a fluid number, and we have several people ready for discharge next week for short-term rehab. So they've completed their therapies and whatnot, and they'll be moving back to their homes or where they were prior. So it's a moving target, but right now we're doing pretty well as far as admitting people who are available from the community, and a lot of times we are their first choice because of the reputation at Westmount. So we're very pleased with that. Basically, unless you've got anything else, that is a summation for what we have today. If you have any questions.
Just that galvanized pipe repair, did that come in, on budget, a little under budget? How did that?
We had quite the range of estimates. We had 4 estimates. It ranged, I think, don't hold me to it, but it was like 22,000 was the high one. There was another one at 20, one around 12, and we came in around 68. The one who did it, they did it for 68. So,
And do I recall the transfer, was it 20 we transferred to that line? I don't recall what we put money in that account.
I transferred the higher amount.
yeah, so I actually came in under. I was surprised at the range of estimates for. They all knew the exact job, and we walked them all through it. So.
Good. Very good. Thank you.
Okay.
Anything else for Westmount? Mr. Whitehead, did you?
A couple months ago, I asked about year 9 Siemens report, the guaranteed savings report, and I was wondering whether there's that report's available for viewing.
Unfortunately, the gentlemen that probably could answer that are not here.
All right. Well, then I've got a couple more questions for them. It's my understanding that, well, I know that there's a line item for that report. It's about $10,000 report every year. So, if we paid the money, I'd like to know where the report is. I don't think it's any different than if we had paid $10,000 for a tractor, and then we can't find the tractor. It's an issue of misappropriation of funds, public funds. And so I had 2 specific questions for the gentlemen that aren't here. One is, did we pay the $10,000 line item? And if so, where's the report? And if we did not pay that $10,000 item, who decided not to pay that? Because it's quite clear in the contract that if we, for any reason, decide not to pay for that report, then we give up all our rights towards claims against Siemens. So I'd like those 2 answers. It's now in the record. Thank you.
We can maybe, we may have another meeting next week where we could address this, or I could maybe have Paul email you.
Whatever.
Okay.
Thank you.
Thank you.
Is it possible Paul just came over the announcement 15 minutes ago. Is it possible just to see if he's available to answer Mr. Whitehead's question?
I don't know. We'll find out for you, Supervisor Seaver.
We just heard him a couple minutes ago.
Yeah, we do. Actually, I don't think you guys need to hang around. If you don't want, you guys are more than welcome. Thank you very much. We appreciate it.
Thank you very much. Have a good week.
Nice job over there considering everything that's going on. All's on a conference call.
Adjourn.
Motion made by Supervisor Conover, second by Supervisor Taylor. All in favor?
Aye.
Opposed? Carried.